Welcome to the deep dive. Today we're embarking on a really fascinating journey into equine liver health. We're focusing specifically on two important conditions, liver disease and something called hyperbilirubinemia. Now, we've got a stack of great veterinary sources here, and our mission for you, the curious learner, is to pull out those essential nuggets of knowledge, almost like we're solving a medical mystery together.
It really can feel like a mystery sometimes. And the liver, well, it's such a central player in a horse's health, isn't it? It's just an incredible multitasker. Handles everything from metabolism and detoxification to creating essential proteins. So when the liver struggles, those ripple effects, they can be felt throughout the entire horse. And here's a really crucial point, something a lot of people miss. Just because a horse looks jaundiced, yellow, it doesn't automatically mean it has severe primary liver disease.
Oh, wow. Okay.
Yeah, that's a huge diagnostic differentiator. It can prevent a lot of unnecessary panic, frankly.
Wait, hang on. So even if my horse looks yellow, I shouldn't immediately panic about liver failure. That's a massive takeaway right from the start.
Exactly. Don't jump straight to worst case scenario.
Okay. Let's establish some fundamentals then. What exactly are bilirubin and bile acids? Why are they so important in horses?
Absolutely. Let's start with bilirubin. Think of it as a yellowish waste product. It's mostly from old red blood cells breaking down, specifically the heme part. The liver's job is to take this raw bilirubin, we call that unconjugated bilirubin, it's not water-soluble, process it into a ready-to-excrete form,
Right.
which is conjugated bilirubin, that one is water-soluble, and then send it out with the bile. When bilirubin builds up in the blood, well, that's hyperbilirubinemia.
And that causes the yellowing.
That's what causes icterus or jaundice, that yellowing of the gums, skin, or the whites of the eyes, the sclera. You typically start to see it when total bilirubin levels get above 2 to 3 milligrams per deciliter. But here's a quick practical point. A slight yellow tinge in the sclera. It's actually pretty normal in about 10 to 15% of healthy horses, so don't read too much into a very faint yellowing sometimes.
Okay, so the liver is like the recycling plant, transforming this waste product into something the body can actually get rid of.
Got it. Now, beyond bilirubin, you mentioned bile acids. What are they doing in there? This is where you said it gets interesting.
Yes, bile acids or BAs, they're another key player. The liver makes them from cholesterol and then secretes them into the small intestine. Their main job is basically to help digest fats. They emulsify dietary lipids, break them down so the horse can absorb those fatty nutrients. What's really fascinating is this. Most of these bile acids are reabsorbed from the intestine, travel back to the liver through the portal vein, and get recycled.
This whole process, it's called enterohepatic circulation, and it happens incredibly fast. We're talking dozens of times a day for the same bile acid molecule.
That's some serious efficiency.
It is. And here's where horses are truly unique. Unlike us, or dogs, or many other species, horses don't have a gallbladder to store bile acids.
And no gallbladder. Okay, how does that change things?
It's actually a big advantage for vets. It means we can measure their serum bile acid or SBA concentrations at any time of day, doesn't matter when they last ate, and get a pretty consistent reading. So elevated SBAs, usually if they're above, say, 12 micromoles per liter, are a very sensitive and specific indicator of liver disease.
Ah, right, because there's no stored pool being released after a meal to confuse the levels.
Precisely. It tells us there's a liver problem, though not necessarily what the specific problem is, Generally, it means one of three things. Either the liver cells, the hepatocytes, aren't extracting the bile acids from the blood properly, or there's some kind of blockage stopping bile flow that's cholestasis, or, less commonly, there's abnormal blood flow bypassing the liver, a portosystemic shunt.
That unique anatomy actually makes serum bile acids a particularly clear indicator in horses then.
Yeah.
That's really useful for veterinarians. Now, circling back to that point you started with, the yellow isn't always liver disease thing, this is really intriguing. What does that actually mean for horse owners seeing that yellow tinge?
Right. This is such a critical distinction for horses. Because of their unique bilirubin metabolism, hyperbilirubinemia, that yellowing is common and often not indicative of severe primary liver disease, unlike in, say, dogs or cats. We can generally categorize the causes into three neighborhoods, if you will.
Okay, neighborhoods. I like that.
First, there's prehepatic hyperbilirubinemia. This means the problem is before the liver. So too much bilirubin is being made for the liver to handle.
Like it's overwhelmed.
Exactly. Usually this comes from red blood cells breaking down too fast. That's hemolysis. Think of severe conditions like equine infectious anemia, EIA, or red maple toxicity, or neonatal isoerythrolysis in foals.
Okay.
Too much raw material coming in.
Got it. prehepatic, too much production. What's next?
Then you have hepatic hyperbilirubinemia. Now, the problem is in the liver itself. The liver cells are damaged or not working right, so they can't properly take up, process, or excrete the bilirubin. This type usually leads to an increase in both the unconjugated, the raw form, and the conjugated processed form of bilirubin. Examples here would be acute hepatitis, like Thieler's disease, or maybe chronic active hepatitis, or hepatic lipidosis, fatty liver.
Okay, so hepatic means the liver itself is sick. Makes sense.
Yeah.
And the third neighborhood?
Finally, there's posthepatic hyperbilirubinemia. This is after the liver. Something is blocking the normal flow of bile out of the liver and into the intestine. This causes that processed, conjugated bilirubin to basically back up and spill into the bloodstream. And here's a key indicator. If you see that the conjugated or direct bilirubin makes up more than 25% of the total bilirubin, that's a strong red flag, really points toward an actual liver or biliary tract issue.
Like a blockage.
Exactly. Things like cholangiohepatitis, inflammation of the bile ducts, or cholelithiasis, which are gallstones. Yes, horses get them. Or even sometimes the large colon displacing and pressing on the bile ducts.
That makes a lot of sense. Knowing which neighborhood the problem is in really helps narrow things down. But you teased us earlier with a unique horse phenomenon.
The aha moment.
Yes, and this is the one that surprises so many people. Anorexia-induced hyperbilirubinemia. Horses, and maybe even more so ponies and donkeys, can develop quite noticeable yellowing just from not eating or having reduced feed intake.
Seriously? It's from being off their feed. Seriously. Even if their liver is perfectly healthy and there's absolutely no red blood cell destruction happening, the thinking is that when they're not eating, changes in their energy metabolism, maybe competition with fatty acids for uptake into the liver cell, somehow reduce the liver's ability to take up that unconjugated bilirubin from the blood. So it builds up.
Wow.
It's a huge diagnostic differentiator. I mean, I've had cases where an owner was absolutely convinced their horse had eaten something toxic because it looked so yellow.
Understandable reaction.
Totally. But it turned out the horse was just, being a picky eater and hadn't touched its hay for a couple of days. The good news, it completely resolves. The yellowing clears up once the horse starts eating normally again.
So if I see just a hint of yellow in my horse's eyes or gums, and maybe it's also gone off its feet a bit, I shouldn't immediately assume the worst, like toxic poisoning or liver failure. That's actually really reassuring for owners.
Definitely hold off on the panic button in that specific scenario. Always worth a vet check, of course, but anorexia is a very common cause of mild jaundice.
Okay, that's good to know. But this raises the next important question then. If the liver is the problem, if we've ruled out anorexia, what are the common culprits actually causing liver disease, and what signs should we really be looking for then?
Right, so if we're suspecting true liver disease, the causes are quite varied. Probably the most common category we see are toxic hepatopathies, things the horse ingests that damage the liver.
Like what kind of toxins?
The biggest one to know about, unfortunately, is pyrrolizidine alkaloid, or PA, toxicity. This comes from horses eating certain plants. Ragwort is a classic example, but there are others like Crotalaria, Senecio species. The really devastating thing about PAs is that they cause irreversible damage. They mess with cell division, leading to these abnormally large liver cells called megalocytes, and eventually the liver becomes scarred and fibrotic, leading to cirrhosis.
Irreversible. That sounds bad.
It is. And the really tricky part is that the clinical signs often don't show up until months, sometimes even years, after the horse actually ate the toxic plant. By the time you see those signs, weight loss, maybe neurological issues, the damage is usually too far gone, and the prognosis is poor. Other toxins can include things like mycotoxins, which are fungal toxins sometimes found on feedstuffs, or certain drugs if given inappropriately or for too long, like potentially excessive NSAIDs, or antibiotics like rifampicin, even heavy metals, or blue-green algae in water sources.
Okay, toxins are a big one. What else?
Then you have infectious causes. Thieler's disease, also called acute equine hepatitis, is the most common cause of sudden severe liver failure in adult horses. It's often seen maybe 4 to 12 weeks after a horse receives some kind of equine origin biological product like tetanus antitoxin, though not always, and recent research has strongly linked it to a specific virus, equine parvovirus hepatitis, or EQPVH.
Is that one serious?
Very serious. It carries a high mortality rate, unfortunately. Other infections can include bacterial infections ascending up the bile ducts, causing cholangiohepatitis, or Tizer's disease, which affects foals, sometimes leptospirosis, or even migrating parasites like liver flukes, though that's less common. Any other categories?
We also see inflammatory or immune-mediated conditions. Chronic active hepatitis falls into this category, sort of an ongoing progressive inflammation. often without a clearly identifiable cause. We call that idiopathic. And finally, there are metabolic or obstructive causes. Hepatic lipidosis or fatty liver is quite common, especially in overweight ponies, miniature horses, or donkeys when they suddenly go into a negative energy balance, like if they get sick and stop eating. Their body mobilizes too much fat, overwhelming the liver. And obstructions, like we mentioned, cholelithiasis, those gallstones, or sometimes anatomical issues, like a dorsal displacement of the large colon, which can physically compress the bile ducts temporarily. Oh, and neoplasia, cancer can happen, but it's relatively uncommon as a primary liver issue. Wow, okay. It sounds like there's quite a range of things that can go wrong, from poisons to viruses to just metabolic overload. So what does this all mean for recognizing a problem? You mentioned some signs earlier, but what are the key signs owners should look out for? Because it sounds like many of them are pretty non-specific, things like lethargy or weight loss. Is there a risk that owners might dismiss them as just off days until it's, well, too late?
You hit on a really, really important point there. Yes, the clinical signs are often vague, frustratingly so. Things like lethargy, depression, not wanting to eat, gradual weight loss. And unfortunately, these signs typically don't become obvious until a huge amount of liver function is already lost. We're talking over 70, maybe even 80%. The liver has a massive reserve capacity, which is good, but it means disease can be quite advanced before we see clear signs.
70 to 80%.
Wow.
That doesn't leave much room for error in detection.
Exactly. So recognizing them early is hard, but crucial. There are some more specific red flags to watch for, though. Of course, there's icterus or jaundice, the yellowing we've discussed. But again, always keep that anorexia possibility in the back of your mind.
Right. Don't panic, but investigate.
Precisely. One of the most serious signs indicating severe dysfunction is hepatic encephalopathy. These are neurological problems. It happens because the sick liver can't detoxify ammonia and other nasty things coming from the gut, and these toxins reach the brain. So you might see signs like aimless wandering, maybe compulsive circling, head pressing against a wall or fence.
Head pressing, I've heard of that.
Yes, it's a classic sign. Also, ataxia or stumbling, excessive yawning, drowsiness that seems abnormal, maybe apparent blindness where they don't react to things visually, and in really severe cases, you can get seizures or even coma. Any neurological sign in a horse that's also showing general signs of illness should make you think about the liver.
Okay, neurological signs are a big red flag. What else?
Another really distinct sign, especially in horses with white markings or unpigmented skin, is photosensitization. Now, this isn't just a simple sunburn. What happens is the damaged liver fails to excrete a substance called phytoerythrin, which is a breakdown product of chlorophyll from green plants. This phytoerythrin builds up in the skin, and when exposed to UV light from the sun, it reacts and causes severe skin damage, intense inflammation, like a horrific sunburn, swelling, pain, and even sloughing or peeling of the skin on those white areas.
Ouch, that sounds terrible.
It is very painful for the horse. And then there's coagulopathy, which is just a fancy term for a bleeding tendency. The liver is responsible for making most of the clotting factors that help blood clot properly. So when the liver's really sick, it can't make enough of them. You might notice unexplained bruising, little pinpoint hemorrhages called petechiae on the gums, maybe nosebleeds, or prolonged bleeding from even small cuts or injection sites. And then other, maybe slightly less specific signs can sometimes include recurrent colic, diarrhea or edema, that fluid swelling, often under the belly or on the lower legs. Fever can also sometimes be present, especially with infectious or inflammatory causes.
That's quite a spectrum of signs, from really subtle early on to quite dramatic and severe later. It really underscores how much information a vet needs to gather to pinpoint the problem. So how do veterinarians definitively diagnose liver disease and tell the difference between all these potential causes? It sounds like solving a real puzzle.
It absolutely is a diagnostic puzzle. And you're right, it requires putting together many pieces. You need the horse's history, the clinical signs we just talked about, specific laboratory tests, often diagnostic imaging like ultrasound, and frequently the definitive step is a liver biopsy. When we run laboratory tests, we're looking at a couple of different categories. Some blood tests tell us about liver damage, like are liver cells leaking their contents, and others tell us about liver function. Is the liver actually doing its jobs?
Damage versus function. Okay.
For damage, we look at liver enzymes. In horses, the most sensitive indicator is GGT, gamma-glutamyl transferase. If GGT is up, it's a strong sign that something's likely going on with the liver cells or the bile ducts. It also has a fairly long half-life, meaning it stays elevated for a while after the initial injury. Other important enzymes are SDH, sorbitol dehydrogenase, and sometimes GLDH, glutamate dehydrogenase. These are highly liver-specific and indicate acute hepatocellular necrosis, active, recent liver cell death. SDH is particularly useful because it has a very short half-life, just 12 to 24 hours.
Oh, so if SDH is high, the damage is happening right now or very recently.
Exactly. It's excellent for monitoring acute injury. If it starts dropping, maybe the damage is resolving. We also look at AST, aspartate aminotransferase, but it's less specific because muscle damage also causes AST to rise, so you always check it alongside a muscle enzyme like CK. ALP, alkaline phosphatase, is another one, but again, less specific in horses than GGT. It can go up with bile duct issues or sometimes just chronic disease.
So GGT and SDH are the really key ones for damage. What about function?
Now, for assessing actual liver function, how well the liver is doing its job, serum bile acids are truly the gold standard, the best indicator in horses. As we discussed, because they don't have a gallbladder, a Rander sample showing elevated SBAs directly reflects the liver's reduced ability to clear them from the blood. It tells you the liver's functional capacity is compromised. And remember, no fasting needed, which is a huge practical plus.
Right, the no gallbladder advantage.
Exactly. Bilirubin levels, total, and the breakdown into conjugated and unconjugated also help assess function and differentiate causes like we talked about. If that conjugated fraction is over 25% of the total, that strongly suggests a problem with bile excretion, hence liver or biliary disease. Other tests that reflect function include albumin. The liver makes this protein, so levels can drop in chronic liver failure. Blood urea nitrogen, or BUN, might actually decrease with severe liver failure because the liver is needed to convert ammonia into urea. And speaking of ammonia, we can measure blood ammonia levels directly. They'll often be elevated if the horse has hepatic encephalopathy. Finally, checking a coagulation profile test like PT and APTT is crucial. Prolonged clotting times indicate severe liver dysfunction because those clotting factors aren't being made.
That's a lot of information from blood work alone. What about seeing the liver?
That's where diagnostic imaging comes in, primarily abdominal ultrasonography. Ultrasound lets us actually visualize the liver. We can assess its size, look at the texture of the parenchyma, the liver tissue itself, check for any suspicious masses, abscesses, or those coliths, the gallstones. We can also look for dilated bile ducts, which would indicate an obstruction. Ultrasound is also absolutely essential for guiding the next step, which is often the liver biopsy.
The gold standard, you said.
It really is. Getting an actual tissue sample for histopathology examination under the microscope by a pathologist is the only way to get a definitive diagnosis in many cases. It tells us the specific type of disease process. Is it acute hepatitis? Is there fibrosis or scarring? Is it that PA toxicity with megalocytes? It also tells us the extent and severity of the damage, which is vital for guiding treatment decisions and, importantly, for giving the owner a realistic prognosis. But because the liver is so vascular and sick livers can have clotting problems, we always check the coagulation profile before attempting a biopsy due to the risk of bleeding.
That comprehensive approach history, signs, bloods, ultrasound, biopsy, really helps connect all the dots and build the full picture. So let's say a horse gets that diagnosis, liver disease. What does the road ahead look like? What are the treatment and management strategies?
Well, the main goals are generally pretty straightforward, though achieving them can be challenging. First, if we can identify a specific cause, like a toxin or an infection, we need to remove or treat that cause. Stop exposure to the PA plants, treat the bacterial infection, etc. Second, and this is often the main focus, we need to provide supportive care to help the liver function as best it can and hopefully allow it to regenerate. The liver has amazing regenerative capacity if it's given a chance. And third, we need to manage any complications that have arisen, like the neurological signs or bleeding problems.
Okay, so what does that supportive care involve?
A huge part of it is nutritional support. This is critical. We want a diet that's easy for the compromised liver to handle. That usually means high and easily digestible carbohydrates for energy, moderate and good quality protein, not excessive, and low in fat. Things like beet pulp, maybe some oats, good quality grass hay are often recommended. Feeding frequent small meals is much better than 1 or 2 large ones as it reduces the metabolic load on the liver after eating. If the horse isn't eating well, intravenous fluids with dextrose, which is a simple sugar, are crucial to provide calories and hydration. We also typically supplement with vitamins. Vitamins are important for energy metabolism. Vitamin E is a key antioxidant to help protect liver cells, and vitamin K is given if there's any concern about clotting.
Makes sense. Feed the horse, but gently. What about managing those complications like the neurological signs?
Right, for hepatoencephalopathy, the goal is to reduce the amount of ammonia and other toxins being absorbed from the gut. The mainstay medication here is usually lactulose. It's a type of sugar that isn't absorbed. It works in the gut to acidify the contents, which traps ammonia as ammonium ions so they can't be absorbed, and it also acts as a laxative to help move things through faster. Sometimes oral antibiotics like neomycin or metronidazole might be used alongside lactulose. These help reduce the population of bacteria in the gut that produce ammonia in the first place. For managing other complications, if there's photosensitization, the horse absolutely must be kept in a dark stable out of all sunlight. Sunscreens can be applied to affected skin if they have to go out briefly, but avoidance is key. If there's coagulopathy, vitamin K1 injections are given, and in severe bleeding cases, plasma transfusions might be needed to provide those missing clotting factors immediately.
This all sounds really intensive, especially managing the HE and providing that nutritional support. So what's the expected course? What's the prognosis generally for a horse diagnosed with liver disease? What's the outlook like?
Yeah, the prognosis, it's highly variable. It really depends heavily on several factors. The specific type of liver disease, how much damage has already occurred when it's diagnosed, whether those severe clinical signs like HE or coagulopathy are present, how well the horse responds to the intensive treatment, and of course, what the liver biopsy ultimately shows us.
So some types are worse than others.
Definitely. For acute hepatitis, like Thieler's disease, if it's very severe, the prognosis can be guarded to poor just due to the acute failure. However, if they survive the initial crisis, horses can often make a full recovery because the underlying liver structure might still be okay. On the other hand, for toxic hepatopathies, especially paralizidine alkaloid toxicosis, the prognosis is generally poor once clinical signs are evident. That's because the damage, the fibrosis, and cirrhosis is largely irreversible by that stage. We actually have some data point studies have shown that very high serum bile acid concentrations, say over 50 micromoles per liter in PA toxicosis, or even just consistently above 20 micromoles per liter in general equine liver disease, are associated with a much poorer chance of survival.
Those SBA levels are prognostic indicators too then.
They can be, yes. For chronic active hepatitis, the inflammatory kind, it's variable. Some horses respond quite well to long-term treatment, often involving corticosteroids or other immunosuppressants, but it can be a progressive disease in others. Hepatic lipidosis, the fatty liver in ponies and minis, carries a guarded prognosis. It really depends on the severity and how aggressively you can provide that nutritional support and reverse the negative energy balance. It requires intensive care. Things like cholangiohepatitis or cholelithiasis, gallstones. The prognosis is variable, maybe better if the infection can be cleared or if the stones are amenable to medical management, though surgery is sometimes attempted but risky.
And what about those really severe signs?
That's a crucial prognostic point. If a horse is showing significant signs of hepatic encephalopathy, the head pressing, circling, severe drowsiness, or has evidence of significant coagulopathy like spontaneous bleeding, the prognosis is almost always guarded to poor, regardless of the underlying cause. Those signs indicate very advanced liver failure.
That makes sense. But what about the good news scenario?
Ah, yes. Let's not forget that. Remember our initial aha moment, that anorexia-induced icterus. That has an excellent prognosis. Once the horse starts eating properly again, the jaundice resolves, and there are no long-term consequences for the liver. That's a huge relief for owners who might see yellow and fear the worst.
That's a really important distinction to end on.
Absolutely. So, I guess to wrap things up, the world of equine liver health is undeniably complex. Getting an accurate diagnosis is just so critical. And while hyperbilirubinemia, that yellowing is a pretty common finding in horses for various reasons, pinpointing its specific cause is the absolute key for guiding the right treatment and predicting the most likely outcome for that individual horse.
What an incredible deep dive. It really illuminates the liver's incredibly vital, multifaceted role in horse health. It highlights how so many interconnected systems have to work perfectly for an animal to thrive, doesn't it? And how one imbalance, especially in a powerhouse organ like the liver, can have such wide-ranging systemic effects. This whole understanding of the liver's unique metabolism in horses, the different causes of jaundice, the diagnostic approach, it truly emphasizes the power of precise diagnostic thinking. So for you, our curious listener, reflecting on all this complexity, what aspect of equine health will you choose to explore more deeply next?